I'm Amanda Olson, and I'm a doctor of physical therapy and certified pelvic floor specialist. And we're going to talk about some exercises to do after you've had laparoscopic surgery in the abdomen or the pelvis. Always consult your physician as to what your post-surgical plan is, and just keep in mind that no two laparoscopic surgeries are the same. And so depending on where the surgery was performed and how many incisions were made, your recovery time might look a little different. So consult with your physician and your surgeon before beginning any exercise program. In general, it's safe to begin some very gentle activation of the pelvic floor and the abdominals within the first few days of surgery. And what this looks like is you're just going to be coupling your breathing with very, very gentle activations of the pelvic floor and abdomen. So the cue for activating the pelvic floor is going to be to imagine that you are contracting the pelvic floor as if your urethra, where the urine comes out, is a telescope and you're pulling it up and into your body. So I'm going to be doing these laying down on my back because that's the position that most of us are in after surgery. And so you can do this in your bed, laying down flat. If it's not comfortable to be completely flat, you can always put a sleeping bag or something under your knees and really focus on not only the activation, which is going to be very, very gentle, but the relaxation part as well. So after the muscles contract, you want to optimally let them relax. Also, we're going to be making some funny noises, so make sure that you have a nice quiet space so that nobody thinks you're in there talking to yourself. Okay, so you'll start laying down on your back. I'm going to have my knees bent here just to protect my back, but you can also do these laying totally flat as well. So you're going to inhale, and then you're going to exhale and make a sound like a flat tire. It's going to be a shh sound. So when you inhale, it'll be through your nose, and then exhale, shh. That shh sound causes the muscles to gently contract, and you're not going to do any extra activation on top of that. So the shh sound is just bringing the abdominals gently down, and then you'll inhale and repeat. And you can do that 10 times in a row. So shh, in that order. After 10 of those, the next sound is going to be a hut. And when you say the word hut, that final T sound forces a little bit of a sharper exhale in through the abdomen. So you'll inhale through your nose and then hut, hut. So just get a sense of that feeling of saying that hard T sound. You can say it quietly too. I'm saying it loud here so that you can hear me. The last exercise to do in this very early stages post-surgically is just a basic Kegel exercise with the breath. So you'll inhale, and on the exhale, we're going to contract and pull that pelvic floor up and in like a telescope and hold it for about 1 to 3 seconds. So we'll inhale, exhale, and contract. Depending on where the surgery was, you may have had instrumentation in your abdomen and in the vaginal canal or the rectal canal. And so by doing these early little activations, it's kind of like a little bit of a contraction to get some fresh blood flow into the muscles and into the area. If you can do them twice a day, that's great. Recognizing the importance also of drinking plenty of water and getting plenty of rest, especially in those early days. For more information, you can visit intimaterose.com and look for other videos on further out post-operatively for laparoscopic surgery on scar tissue mobilization and more progressive exercises.